If something happened to your heart tonight, would you actually know why? Most people wouldn't. They believe heart attacks come with warning signs, pain, panic, something obvious, but after 60, the most dangerous ones don't look like that. They happen quietly while you sleep. No warning, no time to react, no second chance. And what surprises most people is that the trigger is rarely dramatic. It's usually something small, something that felt completely normal, something they did just before going to bed. I'm a Dr. Michael Carter. For more than 20 years, I've treated patients in critical conditions. I've opened blocked arteries, removed clots, and tried to restart hearts that stopped in the middle of the night. And over time, I began to notice something. Many of these patients were not reckless. They weren't ignoring symptoms. They were doing what most people would consider normal. They ate dinner, went to bed, and expected to wake up. But something in their routine was quietly putting their heart under stress. And that stress built up over time. Your heart does not stop working when you sleep, it changes mode. At night, your body is supposed to recover, blood pressure drops, heart rate slows, blood vessels relax. This process is essential. It allows your heart to reset. But after 60, this system becomes less reliable. Blood vessels become stiffer, pressure regulation weakens, and the margin for error gets smaller. During the day, your body can compensate. At night, many of those protective systems are reduced, which means your heart becomes more vulnerable. That's why the most dangerous hours are between midnight and early morning, not because something suddenly appears, but because your body is less able to handle stress. And what determines that stress is often what you did just before going to sleep. Let me ask you something. What time did you eat dinner last night? For many people, it's late, 8, 9, sometimes even 10, a full meal, heavy food, and then sleep. From a cardiovascular perspective, this creates a problem. When you eat a large meal, your body needs more blood for digestion. Your heart has to pump harder, blood pressure rises, and fat levels in the blood increase. And all of this happens just as your body is trying to slow down. Instead of resting, your heart is still working. Over time, this creates unnecessary stress. A simple adjustment can help. Try to finish your main meal at least 3 hours before sleep. Now let's talk about something many people overlook: medication timing. If you take blood pressure medication, when you take it matters. Blood pressure follows a daily rhythm. It rises during the day and it should drop at night. But for many people over 60, that drop doesn't happen. Sometimes it stays high, sometimes it even increases, and most people don't know it. If medication is taken only in the morning, its effect may wear off by nighttime, which leaves your heart less protected during the most vulnerable hours. This is not something to guess about, it's something to discuss with your doctor. A simple adjustment in timing can make a real difference. So now let's talk about something people often ignore, snoring. Most people think it's harmless. It's not always. It can be a sign of sleep apnea, a condition where breathing repeatedly stops during sleep. Each time that happens, oxygen levels drop, the body reacts with stress, heart rate increases, blood pressure spikes, and this can happen dozens of times per hour, night after night. Over time, this creates serious strain on the heart. It increases the risk of heart attack, stroke, and irregular heart rhythms. The problem is many people don't know what's happening. They sleep through it, but the body does not. If you snore loudly or wake up feeling tired, this is something to take seriously. Another common habit is avoiding water in the evening. People do this to avoid waking up at night, but mild dehydration has consequences. When your body lacks fluid, your blood becomes thicker and flows less easily. During sleep, circulation already slows down, and when thicker blood moves through narrowed vessels, the risk increases. A simple solution helps. Drink a moderate amount of water before bed, not too much, just enough to maintain balance. Even your sleeping environment matters. Temperature affects your heart. If the room is too warm, your heart rate stays elevated. If it's too cold, blood vessels tighten and pressure increases. Both conditions create unnecessary stress. A comfortable, moderate temperature helps your body stay stable and supports better recovery during sleep. When you put all of this together, a clear pattern appears. Eat earlier, pay attention to medication timing, take sleep quality seriously, stay hydrated, and keep your environment comfortable. These are simple changes, but together they reduce stress on your heart night after night. Before we finish, I want you to check something, not a quiz, a real signal your body might already be giving you. I'll name a few patterns that cardiologists actually look for. Be honest with yourself. Give yourself 1 point for each one that applies to you. Let's get started. Do you often wake up between 2 and 4 a.m. for no clear reason? Do you wake up with a dry mouth, headache, or a feeling of pressure in your head? Have you ever been told that you snore loudly or stop breathing during sleep? Do you sometimes feel your heart beating harder or faster when you lie down at night? Do you wake up feeling tired even after what should have been a full night of sleep? Do you eat dinner late within 2 hours before going to bed? And do you sometimes avoid drinking water in the evening, even if you feel slightly thirsty? Now, pause for a second, count your score. If you have 0 or 1, your risk is likely low. If you have 2 or 3, your body may already be under stress during the night. And if you have 4 or more, you should not ignore this because these are not random symptoms. They are patterns we often see in patients before serious cardiovascular events. And here's what matters. Most people don't connect these signs to their heart. They think it's just age or stress or poor sleep. But in many cases, it's your cardiovascular system struggling at night. These are not random symptoms. They are patterns we see again and again in patients who later end up in emergency care. And the difficult part is this, by the time something serious happens, it often feels sudden, but it wasn't. It was building quietly over weeks, months, sometimes years. I remember one patient in particular, he was 67, active, no major complaints. He told me he sometimes woke up at night feeling slightly uncomfortable, but he ignored it. He thought it was just age. One night, that discomfort didn't go away. And that's when everything changed. What struck me most wasn't the event itself. It was how many signals had been there before. Quiet, consistent, and completely ignored. So this is not about fear. It's about awareness, because once you recognize the pattern, you can change it. And you don't need to change everything at once. So start small. Finish dinner earlier. Drink a glass of water before bed. Pay attention to how you sleep. Even one small adjustment can reduce the stress your heart experiences every night. Your heart has been working for you every second of your life. Even when you sleep, even when you don't think about it, the question is, are you giving it the conditions it needs to keep going? Because what you do tonight is not just a habit, it's a signal. And over time, those signals become outcomes. Take this seriously. Not tomorrow, tonight. And I want to know how many of those signs apply to you. Write just the number in the comments. It helps more than you think. And if this video made you look at your routine differently, share it with someone who needs to see it. Most people have no idea until it's too late. Take care of yourself, and I'll see you in the next one.